Do you have a specific plan to create more private sector jobs, and what is it?
Well, my specific plan is, as a business person, I recognize the tax and regulatory burdens that so much inhibit new business investment and innovation. One of the first things that I want to do when I go to Washington is push for the elimination of the capital gains tax. I believe it's double taxation, but it also prohibits and it inhibits investors and the investment community to make additional investment to grow their companies, to seek alternative technologies and to support alternative technologies. If we can't, people are motivated by the return on investment, by the profit motive. And if we take too much of that profit in the form of capital gains, then the marginal return simply isn't there. People, when they commit themselves to a project and risk their money and make that big time commitment personally and with others in a consortium of business folks, people need a reliable expectation that there will be a significant return in profit. That's the way business has traditionally, over the last 100 years in this country, made it work. And they're the engines of growth. They support 70 to 80% of our jobs here in this country. And I believe that we simply have to release business people from the burdens of capital gains tax, which now is expected to go from 15 to 20, maybe even 28% under the Obama proposals coming up. And I think that's a huge mistake, and it's just the opposite way the way we need to go to create jobs in this country.
Thank you.
Mr. Carlson.
Yes, sir.
Pleased to meet you, sir.
To meet you.
I have a two-part question for you. Are there any parts of the health care legislation that you support? What are they, and what is your position on repealing that bill?
First, let me answer the second portion. I advocate repeal of the bill. I believe we have a problem in health care delivery, but it's a cost problem. It's not a quality problem. It's a cost problem. And what drives that cost problem is that we have third-party payers who actually are paying the bill for our usage of health care. And so you and I, even for example in Medicare, it's a third-party system again, and health insurance in general. So you and I don't have any incentive to shop around to try to reduce our expenditures on our actual health decisions. If we were to move toward a much stronger emphasis on health savings accounts, where, for example, we had a tax deduction in the range of $5,000 a year to put in a health savings account for our family and ourselves, wherein we use those dollars, which are our own dollars, in paying for our medical needs. I believe we can really cut down that cost curve, because you and I, just like we do at the grocery store, are going to look for the best price. But we're not looking for the best price. We're not looking for the biggest bang for the dollar right now, because either Blue Cross or Blue Shield or Medicare or some other third party is paying, and so we don't have any direct relationship with that payment. We don't actually write the check. When we start writing the check, it's going to make a big difference in the cost. I think that junk liability lawsuits, which plague this country right now and drive up the cost of insurance in general, and especially for doctors in many fields. My brother is an emergency physician out in Seattle, Washington. His premium for liability insurance is $100,000. So what that means, of course, is that he has to, in the billing to the folks that he serves, cover that cost. I mean, so his fees are raised as a result, and this is universally across the board. So, and the reason, of course, that those premiums are so high is because the tort lawyers are shopping around and ambulance chasing and looking for an opportunity to gain a big fee from pushing what is a marginal expectation of a service rendered that was done improperly, and basically the insurance companies will settle because it's just more costly to litigate. So you get this. There's this huge overlay of costs for medical care delivery that doesn't do anything for you and I in terms of our actual health outcomes. One of the things that we face in this country too is that, and I'm going to go back to my brother, who again in Seattle, because he's my best example. I know it directly. In his emergency rooms, and he is a CEO of a large contract organization who provides emergency room physicians to a number of hospitals in Seattle. He has to keep 24/7 a Spanish-speaking person in the emergency room to translate for the folks, the 20 to 30% of the illegal Hispanic population that come in. And Seattle is 1,500 miles away from the Mexican border. So this problem, this 20 or 30% of the population that he sees come through the emergency room. They're there for sore throats and back pain and a lot of maternity issues, because a lot of the folks are trying to do what they can to have for themselves an egg or baby so that they can justify staying in this country illegally. That 20 to 30% of that population that they are seeing, they don't get paid for. So it's then passed on to you and I, the people who actually pay the bills, and again, increasing the costs. So I think a healthcare delivery system in this country is not a matter of the quality of care, the innovations that are so prominent in this country. This is where all innovation happens, both in terms of drug delivery and new surgical procedure. It's a cost issue, and there are clear recognizable, small-scale revisions and changes that we can make to address that issue.
So we do need reform.
We do need reform. I gave you two examples, but we don't need to throw out the baby with the bathwater. We don't need to have government take over healthcare delivery. We've seen across this country that that's a very inefficient means of healthcare delivery, and it just puts further tax burden and it limits innovation, because there's no, for example, the Da Vinci system of surgical intervention. It's basically a exterior surgical procedure that eliminates the necessity to open up large incisions. That new innovation was developed right here in this country, and it was developed because there was some expectation that there would be a considerable profit as a result, and in fact it has come about.
And government had nothing to do with it.
Government had nothing to do with it.
Yeah.
It was all privately financed.
Right.
And now we have a revolution in a lot of surgical procedure as a result. Prostrate surgery, abdominal surgery in general has remarkably improved. improved, people can go back back home within 2 or 3 days rather than 2 or 3 weeks. So it's just a remarkable example of what we can, depending on private initiative, to improve healthcare delivery.
Thank you very much.